Hi, everybody. Welcome to this special edition of the Dr. Keith Darrow podcast, where I welcome Matt Prados at Review Wave. Matt, thank you so much for being here today.
Absolutely. Thanks for having me.
Absolutely. So, Matt, I know you and I met, probably at least 4 or 5 years ago at a conference we were hosting in Boston. It was a great event. And I mean, even back then, you were already moving and grooving in terms of sort of getting yourself inserted into hearing healthcare to help practices grow. And honestly, I think I left that meeting thinking, Matt's role was reviews, Review Wave, helping to build an online presence, reputation, but you're so much more than that now. So I would love to know about your journey.
Yeah, absolutely. I mean, we definitely did start as just reviews, hence the name Review Wave. It was a little side project. Actually, I own a digital marketing agency, and we worked with a lot of doctors all across the US and Canada using the same kind of websites, the same keywords, the same funnels, templates, ad types, et cetera. And so I did an analysis about 6-ish years ago and found that after a long analysis, lots of digging through analytics, all this kind of stuff. But long story short, the guys with the most reviews got the most new patients from the internet. So I was like, okay, well, that makes sense.
Did you really need that long of an analysis?
6 or 7 years ago was a different game. I mean, today it's like,
fair,
obviously, right? I mean, you don't go on Amazon with looking at the number of reviews, the review rating, and before you buy a product, right? But 6 or 7 years ago, people still talk to each other at the dinner table. They weren't glued to their cell phones, et cetera. So anyway, we started coaching guys on it. We started giving them handouts. Nothing worked. So we created a little bit of software that would allow the office to send out requests via text and email. And then it started to work decently. But then we said, hey, we gotta really turn this up a notch. We automated it by integrating with electronic health records softwares. And then it was like, boom, explosion, magic, doing a great job. And as we, got traction, we started to get our review product into the hands of lots of doctors. They said, well, hey, we're paying you for reviews. We're paying the EHR for the EHR. We're paying somebody else for texting. We're paying somebody else for this other thing. And there was all these pieces and they were band-aiding everything together. And it's really our journey over the last 5 years is to remove the band-aids and really put an all-in-one patient experience engine together so that any doctor, any audiologist, any chiropractor, any optometrist, any dentist can plug their software in and just immediately out of the box have amazing results, more reviews, better retention, reactivating old patients, online scheduling for higher conversions on the website because they're already spending money for SEO and AdWords and Facebook ads or all these various things they're doing. And so we really enhanced everything and just became just an unbelievable asset for any of these doctors' offices. So,
well, and that's how. Look, I'm the provider. I'm the clinician. I stay in my lane. My business partner Jared Brader, he manages all that. So I've heard sort of a bit of the journey along the way, but it's not my focus. And what I remember when I was sort of starting fresh in my practice and thinking about reviews was exactly what you said, which is, okay, I had this review software. And at the time, before we had even met, I was working with Podium. And I remember the concept of, it was all like this, right? Where it was like, you had this one piece, but then you had to integrate it with something else. And then you had to do this, and then you had to do that. And all I remember was the headache of the entire process. It's become seamless. And what has that been like for the end user? Because I remember you had to push 17 buttons just to ask somebody for a review.
Yeah. So, I mean, you press as few clicks as possible in our platform when we send out feedback requests to the patients, the providers and the staff. I mean, they literally touch nothing. It takes us about 60 minutes to get an office completely set up to have all kinds of things going. Wow. From campaigns for, your warranty is about to expire, your online scheduling embedded into your bit. We've got a mobile app. So if patients want to schedule their appointments on a mobile app, they've got that. One of the interesting things about us, because we work in more than one discipline, is your patient may, come see you. They may also go see a local chiropractor. They may also see a local dentist. And if all of those providers are a ReviewWave client, they can literally use the scheduling app that we provide to schedule and reschedule appointments for all of those specialties that they may need for not only themselves, but also their dependents, which could also be, their parents as well as their kids in today's day and age, obviously. And
so what I just heard you say is, Matt, you went from this back end software to now actually patient is using it.
Yep, we've got mobile apps for the patients. We've got mobile apps for the providers. So you can take your texting on the go. If you're going in between offices, you can have all your text right there on the one app in your phone, et cetera. So we've really just, taken marketing automation, taking, patient engagement, taking patient experience, kind of like rolled them all up into one ball and templatized everything. So you can basically just turn it on and it just works, right? Your appointment reminders are going out. We use the office number versus some random number or some short code. So it's easier for the patient to understand, hey, I can call this number. I can text this number. It just makes sense, right? And, you can have missed appointment text. You can have reactivation text. You can have birthday text. I mean, everything that you would want to care for that patient, we've built into the platform and just made it, run super, super smooth.
Now it's not an OMS.
No. So we're not replacing Cycle or Blueprint or, these types of things. We, basically we lay on top of that. So you keep your existing scheduling, you keep your existing billing software. ReviewWave lays right on top and fills in all of the gaps. Now, some of the EHRs provide, baked in stuff, little bits here, little bits there, but those are the afterthoughts. Their core competency is the EHR, right?
Right.
And so if you want to use the best of the best, use their EHR, but then, get the best of the best in the other stuff, which is just not them and they're baked on products.
Yeah. And I think that's a great way to put it, because a lot of people, especially if you're in hearing healthcare, you've heard your OMS provider say, oh, we can automate this. Oh, we can automate that. But I don't even know how to compare it. We're really talking apples and screwdrivers, right?
Yeah.
We're talking two completely different. Let them stay in their lane. And they do. Some of the OMSs do a great job at helping you manage your database, your patients from a healthcare side, but from a nurturing side, from a contact, from a relationship side, correct me if I'm wrong, but that's where ReviewWave comes in.
Yeah, absolutely. We're definitely best in class there. We're certainly not going to be the cheapest product on the market, but I mean, who wants the cheapest when it comes to their practice? I mean, you should want to spend, you have the best of the best for everything that you do, right? And, but yeah, absolutely. We can lay on top of these great, companies that are doing wonderful jobs at EHRs, and we can take your practice to a whole nother level in, a matter of days and weeks with the implementation.
So tell me about your sort of, right, because you do come from a different standpoint. So if people are listening there and hearing healthcare chiropractor, right, you don't come from a clinical perspective. I've always thought of you as sort of the patient relationship. So what is your philosophy? How do you approach that when building this system?
Sure. So, I'll go way back here. I grew up, both my parents were chiropractors. So I grew up, the son of entrepreneurs. I watched them, go through school. I watched them graduate. I watched them open their first practice. I helped them, build, like literally hang sheetrock in the office, when I was 13 and they had bought a building. I saw the different things that they went through. And so, I worked there in my teenage years when I was in high school. So I had a very intimate relationship with, the small business, the small business entrepreneur, the family practice kind of thing. Right. And so, when I, started my career, I got into sales and marketing and, absolutely loved sales, one-on-one sales. But then I started to learn about this marketing thing, which was selling to more than one person at a time. Mm-hmm. Really love that. And then, okay, I'm going to date myself. Then the internet comes around and starts to get some traction, right? And then, from there, I'm like, wow, now you can really talk to a lot of people, because now you're not just talking about newspapers or radio type stuff. Now you've got this internet thing. And so I just, I've always loved that. And so then marketing automation, years ago, when Infusionsoft first came out, it was like the leader in this kind of thing. And so you could tie all these things together. And right. I actually built my, digital agency to be a lifestyle business And what I would do is I used Infusionsoft, and I had a little survey. So when somebody signed up, I would send them the survey. The survey was actually a web form. And so when they put their answers in, I had merge fields for every single answer they gave, which I would then merge into an email template that I had written, which would then get emailed to my VA. This is before VAs were a big thing, and he literally lived in the Philippines. If there was rain, then his hut got wet, and there was no internet, and I'd have to wait for him. But he would take the email, he would paste it into WordPress. I had this thing automated between Infusionsoft plus, him as a VA. And so I fell in love with that concept because I built a lifestyle business where I could literally work, an hour a day and live a very comfortable Southern California life while delivering, top-notch service because of what I knew as a marketer, and the product that I'd put out just worked every time. And so that was my market. I just fell in love with marketing automation because it buys you time. Right?
Sure.
Could you ask your patients? Would asking your patients possibly, one-on-one give you more reviews? Yes, it would, but you're trading off the time, right? So how many things can you either automate or give to somebody else to do in order to grow? And I've loved that message. I love that concept, but I learned it even more here in ReviewWave because we've grown in the last 5 years. We've grown from 0 to 70 staff, right?
Wow.
That is an amazing growth, but what that is really
Are you still only working an hour a day?
Oh no, we're definitely so I went from the lifestyle business. When I started Review, I said this is going to be a legacy business. This is one of those companies that I'm going to build that's going to change hundreds of thousands of people's lives. We actually have tens of millions of patient files that we connect to now. So we're changing tens of millions of people's lives, making their healthcare journey easier, better, et cetera. Right. And so but I took the marketing automation and I put it into ReviewWave as a product to help other small business owners automate their practice so that they can buy back an hour, whether it's an hour a day or 5 hours a day. Sure. At the end of the day, I knew firsthand, my parents sacrificed so many nights and weekends working and traveling to figure out how to run their business better and do these various things. And they would bring their staff to these events to get trained. And then, the staff might leave and they have to do it again. And I said, there's got to be a better way. And so putting marketing automation, you allow that to go in and it doesn't quit on you. It doesn't take vacations. As long as it's not bubble taped together and break, it'll just work. And then your staff get to do better things that help enhance the patient journey even more. It gets more human, which is funny because one of the biggest objections we hear is that, well, we like the human touch. The truth of the matter is if you implement marketing automation, you get more human touch, not less, right? And so
I know what we've learned over the last couple of years is marketing automation with human, right? With human touch, right? And not just in the messaging, but and I'm sure you would agree, if you just send a text and an email that says, leave me a review, I don't know what the numbers are, but maybe 1 in 10, which over time will get you a lot of reviews. Mm-hmm. But if you ask that patient on the way out of the office or let them know, hey, we would love to, understand your experience here. Would you mind if I sent you a link for a review in 5 to 10 minutes? Now you get a yes, now you get involvement, and now you probably get 6 out of 10.
Absolutely. Yeah. There's no doubt you can improve the human touch on it. You can groove it into your systems. When you're doing exams or you're doing appointments or fittings or whatever it may be, you can let them know, hey, we love feedback. You're going to get a request. If you please answer, that would be a great thing that you do for us. So you can definitely tweak all those things. But if you think about it, our scheduling tool alone, if you take a busy office, if we can cut your phone calls in half, and so you're not on the phone, whatever, let's say you were on the phone 2 hours a day. Now you're on the phone 1 hour a day, just because the online scheduling, the scheduling app, get rid of all the scheduling questions. But not only that, your patients enjoy the instant scheduling better because, who wants to call a restaurant and book a reservation? Nobody. You go open table, right. You book it. You don't have to talk to anybody. You don't have to get any attitude. You don't have to be on hold. You just simply pick your time, you hit schedule, you're done, and you move on, right? That's what we've built for, hearing healthcare, dentistry, optometry, chiropractic, et cetera.
So, and what has been the adoption from the patient side? Because I'm sure you've heard it too from sort of the provider's perspective. Oh, my patients don't want that. My patients like to call all those limiting beliefs.
So the funny thing is, in the beginning, we would hear, oh, my patients aren't on Google or aren't on
Oh, yeah.
Facebook. That's
Right.
obviously over, right? People no longer say that. The biggest objection we actually hear now is we don't want to give up control.
Mhm.
And that is a limiting belief because the not giving up control is stopping you, right? The bottom line is we've programmed in AI so that if you set up like, hey, a patient can schedule during these hours and this, all like only this far out and not this close to, they can't
Sure.
schedule to be here in 1 minute. If you put all your business logic that your receptionist would have to use anyway, but you let technology do it, you still have control. And so you're not giving up control, you're just using another mechanism. And I would say, the biggest thing for those guys is like, you have to look at what do your patients want?
Right.
People want online scheduling. People want automated scheduling. It's so obvious that, Open Table wouldn't be the beast it is today if it wasn't, right? Surveys show that so many people want it, but very few providers are giving it.
I got to tell you, I love that analogy, and I hate calling restaurants for a reservation because of how used to it I am now. If I go online and that's not an option, there's a good chance I might choose another restaurant
That's
just
right.
because of the hassle.
And the same thing happens with a doctor. And
Sure.
because the patient experience doesn't start the minute they walk in the door. The patient experience starts the minute they Google audiologist in Boston or wherever they are, and they're
Of
looking
course.
for someone. So your website, what it says, how you act with them on the website, if you have a video, if you have a new patient special, if you've got chat, all these things are part of how that interaction starts. Are you giving them all of the ways they want to interact with you, or are you only giving them the ways you want them to interact with you?
Yeah, I've always said treatment starts the minute they raise their hand.
Mm-hmm.
And that first raise of hand nowadays is through the internet, right? Looking you up, whether it be hearing aids or clarity or tinnitus, whatever it is, their first interaction with you, that's when treatment begins. So you have to put your best face forward. You have to give the patient what they want. And I love that Review Wave can really offer them that opportunity. Plus, right, how many times is your receptionist or front office staff too busy to properly greet a patient, right? You can't ask one person to do two things. You can't ask them to answer every phone call and be a loving grandmother or a loving receptionist that welcomes you and gives you something to eat and a hug, whatever it may be you want.
Right.
You can't do that if they're on the phone.
Right. And so you can get a second team member for, $3,000-$4,000, depending on where you live, or you can get Review Wave for, $300-$400, depending on what features you need. It's literally a no-brainer if you look at it from that standpoint of being able to, not only give the patient a better experience, but your teammates, it gives your staff a better experience because then they're not stressed. They're not trying to do two things at once, and that's going to make their quality of life better. So it's really win-win all the way around.
Sure, sure. Now, how is Review Wave different from some of the other, whether it be automation programs or the other review programs? I mean, I mentioned Podium just because I know we worked with them years ago, and I'm not looking for, this we're better than them, but what
Yep.
makes you guys different?
Yeah. So, at the end of the day, there's some kid in some garage right now who's probably coding a better technology than what all of us, in the marketplace currently use,
Yeah.
right? The difference is not going to be necessarily the technology, but it's going to be the thought that went into the technology,
Okay.
number one. And then it's going to be the delivery of that technology. Because we all know, we're not all completely geniuses in technology. You're going to need some support somewhere. You're going to ask some questions somewhere, right? And so, my CTO, Chief Technology Officer, he always says, for automation, if you put junk in, you get junk out, right? And so, with us, with over a decade of marketing experience, and my marketing experience was very tailored to conversion optimization, which is really that user experience when they hit the website. Right. Because, in towns all across the US, you're only going to get a couple hundred visitors to your website on any given month. So you have to capitalize as much as possible on those few visitors, because an average website converts 1%. That means you get 400 visitors. You're only getting 4 new patient calls and maybe you convert 2 of them and then one comes in and then you maybe sign them up or you don't. And that's why most people have terrible results in their website. But if you can get that conversion rate up to 5% or 10%, all of a sudden you're a rock star. You're,
Right.
You're buying Bentleys and flying private because the new patients are just flowing in, right? So because of all of that experience because we started with reviews and because we listened to the patients and what they needed more than what the doctors thought they wanted, right? Our platform is really built in a different manner. And I mean, our team, is just absolutely amazing. We have on our wall, we've got TVs hung. And so every time a feedback comes in from our own internal, feedback requests to our clients, how's it going? If anything's less than an 8, we're on the phone. How can we improve? How can we be better? How can we help you? And, the culture, that we built and how much each and every one of our team members cares about our clients, those are going to be the differences. We have phone, email, live chat support. We start at 6 a.m. Pacific so we can handle our East Coast clients. We go all the way till 5 p.m., Pacific. So, I mean, we've got almost a 12-hour stint every day of being open. So that to me is the difference with any software company and, whether they.
All right. So you're throwing a lot more out there than even I anticipated from this conversation. So 2 things I got to ask you about. One, so I just learned that ReviewWave is offering a live chat feature. Mm-hmm. So I want to talk about that, but you've said the word website at least 4 or 5 times. Are you guys building and designing website? Are you in a website? Is this a website company or you just integrate with Joe Smith's website?
So both and all of that, okay. I'll say. So my background was internet marketing. So websites are core to me. So we did find a large percentage, interestingly enough, of clients that came to us that wanted online scheduling didn't have a website in today's day and age, which blew my mind. And so after a certain amount of time, we said, all right, we're going to have a website product. So I took
give the people what they want.
Give them what they want. So I put all my decade plus of knowledge in, and so when I first started doing websites were $99 a month. We came out at $400 a month, and people were like, "You're crazy." Now they're $1,000 to $5,000 a month, depending on what program, all the ads, that kind of stuff, right? So because I'm that guy that does the opposite. So everybody swung to the really expensive. I said, all right, if we're gonna do websites, we're going dirt cheap. So literally for $99 a month, we bust out this website. It automatically pre-fills your reviews. It automatically we have digital forms. It puts digital forms on there. It puts your online scheduling on there, and it's all built with the conversion optimization that I talked about, the search engine optimization I talked about. Right. And we came out with a very affordable $49 a month local listing SEO product that will help you rank if you're in a medium to small town. Like it's not going to make or break you in Boston or New York City, but definitely can help the average size town across. So we have that. We do have live chat. When I said live chat support, I meant our team is here 12 hours a day and answers live chats, and we do monitor how fast they answer. So our average response time is sub 2 minutes. Our average time to close a chat is sub 40 minutes. And so we watch those metrics on our support side. However, we do also have a product for chat. Now, what we did with chat, especially because offices, they're busy. They can't necessarily have a rep sitting there watching the chat all the time, right? So what we did, rather than, there's companies in the past, that have had, 24-hour kind of answering service model. Sure. Great model that definitely can work. We went the technology side. We said, hey, let's use technology. So when we have somebody fill it out, we get their cell phone number. So even if they close the browser, we turn it into a text conversation, right? Yeah. And we can have auto responses to that text conversation, and we're weeks away from actually taking it from that to a full AI response capability. So we'll text them something, they'll text back, we'll read the text, and then the AI will respond to it. So it's going to be, obviously the goal to book them, as a new patient, because that's what most of the live chats will be. So yeah, we've got lots of functionality there, lots of opportunity for guys to, help enhance their practice on a very, very affordable budget that is definitely there to give a huge, huge ROI.
So you're going towards the bots where they will be smart enough to sort of interact with the other human being? Is there a product where there is a live person sitting, in the office next to Matt who's chatting back with a patient in Wisconsin?
No, so we did, like audio chats and those guys. I mean, they did
Okay.
great job.
Sure.
And I'm not trying to knock that off. We simply came out with a very affordable version that uses technology.
And I think you would agree that the vast majority, when people are chatting in, they're looking for, right? They're looking for somebody to solve their problem. They want more information. They want a phone number. They want an address. I'm sure AI is way smarter than I am and can figure that out much quicker.
Yeah.
Yeah. So, what's next? I mean, what do you see next in the next 5 to 10 years for Review Wave, but also just this automation marketing field?
Yeah. I mean, it's really going to continue to grow and innovate. And I mean, the innovations, we're not even really going to know until they happen, right? There's so many things that, just technology evolves so fast. There's that one, I forget the name of the law, but that the chip that goes in your phone or whatever, like every 18 months, it can double in size and be cut in half in cost, right?
Right.
And that's the speed at which technology is going. Like TVs used to be $5,000 for like a 40-inch TV, and now you can buy an 80-inch TV for like $700, right?
I just got one.
There you go. and so, it's hard to say where it's going to go, but I can guarantee that whatever you're using now isn't enough. You need to figure out what more is available there, because it's so darn cheap to use technology, right? It's 1/10 of the human cost. And so if you can take your practice and increase it by 10% over the next 6 months by simply spending, $300 or $400 a month, I mean, think about the ROI on that. I mean, what's the size of your practice? You're doing $40,000 a month. So that would be an additional, for $24,000 after spending, $2,400. It's an absolute no-brainer to use technology and just take your experience. You should look at your experience from start to finish. And if you've never looked at it or been able to dissect that, a buddy of mine, Joey Coleman, wrote a book, Never Lose a Customer Again. Phenomenal individual, recovering attorney, super funny, lots of fun to watch. Actually brought him out to our facilities here and had him train our staff firsthand. But his book, you can buy, I don't know, whatever, $17, $20 on Amazon. Never Lose a Customer Again is a great way to start dissecting your patient journey.
So you're talking about secret shopping, or at least understanding what is happening from the patient side, right? I mean, we every single new employee, you've got to put yourself in our system as if you're a patient. You've got to get the phone calls. You have to get the education packets. You have to go in and get a test. You have to, use technology for a couple of weeks. You have to understand the patient journey. You can't just go to school for years and years. You can't just train from a book. You have to see it, walk a mile in the patient's, shoes.
Right. So literally go and Google, audiologists, in your town, or hearing aids in your town, and then look at where do you show up? Where do your competitors show up? But do you have more reviews or less reviews? If you have less reviews, how likely are people to click on your listing versus the guy who has more reviews? And then click on the website. And then once you get to the website, can you find that phone number, right? Do you have to opt in? Does the opt-in form go to spam? Is it actual online scheduling? All these different things. Once you schedule, is there a new patient campaign that you'll get your paperwork, you'll get your directions, you'll get maybe a welcome video. And then there's a custom reminder where it's not just like, hey, Keith, your appointment for tomorrow at, 1:00, see you there, right? You don't know this person yet. You have to take more care of them. Like, hey, Keith, we're super excited to see you tomorrow for the first time. Acknowledge that it's, it is the first appointment, right? Do you have that kind of customization, that human touch, right? Where it's not just, oh, this was a terribly written text, right? Do you have typos in your messaging? So many people do actually have typos, all these things, because that's the patient journey before they even walk in the door, right? And so you want to look at it all from all those steps. And then once they are a patient, did their experience go well? If it did they reschedule? I can't tell you how many times I've walked out of a doctor's office that I should have been rescheduled, that I wasn't even talked to, right?
Yeah.
And then, if I leave, how long am I gone before they try to reschedule me, right? Do they wait 6 months? Maybe I find a new provider by then, right? So many things can happen. So you really want to dissect your entire patient journey from walking in the door. And it's hard. You as the doctor can't do it, because when you walk in the door, any entrepreneur in their business walks through, all the staff sit up straight, they smile, they're like, everything's great. So send one of your friends, send somebody who's going to dummy run this thing for you that they don't know, and get real feedback, and then improve it.
Yeah, nobody can see their own broken windows, right? Nope. You need that outside perspective. I love that. I think that is right. We've been at this now 25 minutes. What a golden nugget you just dropped there. So I got to ask you this one thing though, and let's pretend for a second that we're not recording this. Tell me some of the differences. What has your experience been like working across, from chiropractic, from dentistry, from audiology? What are some of the, what is that like for you? Some of the different personalities or the different perspectives, the inside scoop.
Chiropractors are a much higher volume number of visits per week. So certain things matter more for them. Appointment reminders, can make or break them. If they miss 10% of their appointments in a week, it's not like 5 appointments. It's more like 50 appointments, right? Which is, massive for them. But all in all, outside of the corporate structure, right? So you've got the big conglomerates in all of these things.
I'm talking about the private practices,
the private practice, right? The mom and pop shops. It's really a handful of great people just trying to serve their community and do a great service. There's not really a lot of difference in that. They love what they do. They're passionate about it. They almost all have a story of their own journey that led them to where they are, and that's why that particular industry is dear to their heart. And they're trying to share. And so that's why I love small businesses. I love that they're trying to serve their community. And that's why we have such a servant leadership mentality in our organization here our clients, we are here to serve them. And that's, the biggest difference in our company, I think, than others. But, the hearts of private practice all across the country, they all need help. It's been a hard couple of years, no doubt, being a business owner. No matter what industry you're in, but obviously healthcare even more intense. And we're just here to help them, take some of the world off their shoulders, because that's what they all carry around, is that the weight of the world on their shoulders.
Yeah, I love that answer, and I sort of wondered if that's exactly how you would answer, because that has been our observation, right? I mean, we at Aud Experts, we are coaching in audiology. However, we've already started to open up shops, and we've been working with clients in chiropractic, in real estate, looking at dentistry. Everybody's got the same issues, right? Everybody sort of needs the same mindset. There really is. Look, when you're in the testing room, obviously it's very different across healthcare disciplines. But when it comes to providing remarkable patient care, we can all learn from each other.
100%. And that was one of the reasons I went cross vertical. Is early on in my entrepreneurial career, Dan Kennedy, huge influence in my life. I've been part of his mastermind. I've done private coaching, but one of the most impressive things he ever said to me is, so Matt, if you only ever look at your industry will never progress. You have to look outside your industry, see what other people are doing, so that you can drive the innovation in your industry as you learn it from others. So that's another big part of us, because we work in so many different healthcare specialties, we get the pain points of the different ones, and we find out how can we make it better, in each scenario. So a lot of our stuff is custom to each individual, healthcare vertical, but also, broadly applicable to them all.
I feel like in these realms, you really could play the game 7 Degrees of Dan Kennedy, right? Because we've been there also. Jared and I, we've been in the masterminds. We did some private coaching, and the man's a genius and just sort of really understands big picture. So big nod to Dan Kennedy and all the work that he has done. At this point, I don't know what the name of his company is anymore. It changes often. But, just look up Dan Kennedy and some of his principles. Amazing man. So right before we go, though, I do want to ask you about Tinkerbell. Please tell me more about Tinkerbell.
Tinkerbell is our our puppy. She is a Dane Doodle. So
I don't know what that is.
That's a Great Dane and a Poodle mixed together.
Standard Poodle?
Standard Poodle. So
how big is this thing? Because when I saw that Dane Doodle, I'm like, I've heard a lot of doodles. That's the one
Yeah.
I haven't heard though.
It's very rare. She's about 70, 75 pounds right now. My wife really, really wanted a Great Dane. My boys are allergic to dogs, so we can only have doodles. So that's Tinkerbell is our third dog. We have a Multi-Poo. We have a Cocker Spaniel Poodle called Cockapoo, and then we have a Danoodle or Dane Doodle. And they're all 3/4 poodles, so they are hypoallergenic. Sure. They don't shed. Sure. We got to get them haircuts. It's a lot of upkeep, and I'll tell you, the Danes, they are so much that like they think they're a person. So if there's food on the counter, their nose sees it, they think it's theirs. She has literally eaten, $50, raw steaks off of my counter. We've had to like baby proof our life to help her not get in trouble.
Back to those days, because I know your boys are definitely not at that stage anymore, but I guess you're going back. Well, that's great, Matt. Thank you so much for your time today. What great nuggets just to learn about business, to learn about the patient journey. You and your team at Review Wave went from one of you up to 70. You're obviously doing something right. So I strongly encourage anybody out there, no matter what your discipline is, to look into Review Wave and how it can help to not only grow your practice, but to help you have a better, stronger relationship with your patients. Matt, thank you so much.
Absolutely. Thanks for having me.